All right, now schools have, of course, closed, and we as a country are now on full lockdown. And with all these changes come a shift in how we deal with everyday issues. And something that we deal with on the regular is pain, of course, especially when it comes to little ones. And whether it's headaches and stomach pain or common injuries around the home, we need to know how we can keep our kids safe in these times and what to do in times of pain and injury. And so we're here to chat with pain specialist Dr. Shay Venter about how we can best protect and treat pain while we are in isolation. Thanks very much for joining us, Dr. Venter. I know that taking time from your busy schedule where you are scheduled to work at the hospital, it takes a lot of you, so thank you very much for that.
It's a big pleasure.
Let's first start talking about, you know, obviously kids are very much prone to pain, and especially when they're younger, much younger, it's so difficult to tell what's wrong. Is it your elbow that's sore?
Yes.
Is it your tooth? What's going on? But let's talk about the more common types of pain that we're likely to see in children.
Yeah, so I have a 6-year-old daughter who is at home.
Yes.
So it's been trying times. So yeah, very fitting to talk about this topic. Kids generally are busy and active, and so the injuries they have are generally soft tissue injuries, so little scrapes and bumps and bruises. And unfortunately, when things get bad, you see the odd fracture. I mean, playing sports or just running around the house. And then other most common causes of pain are, especially this time of year, are upper respiratory tract infections, which causes various other types of pain like headaches, sore throats. So those are the most common types of pain I see in general, and what is most common and what people deal with on a daily basis.
So if we could draw up an imaginary spectrum from the very light kind of pain to some of the more severe ones, and how to treat each category of pain, could you sketch that out for us?
So pain in general is divided into two main categories. Your acute pain, which is pain that lasts for up to 4 weeks, and after 4 weeks it becomes chronic pain. And there are various causes for both acute and chronic pain. The most common cause for chronic pain is poorly treated acute pain. So really getting into the acute pain and treating it and targeting it and treating it hard and being aggressive with treatment is really essential to prevent the long-term consequences, which are chronic pain. The most common causes of acute pain are things that I've already mentioned. And then chronic pain could be the more chronic conditions, like arthritis with children, more complex problems like autoimmune problems like lupus. But these are most of the things that I deal with in my practice, which is more specialized, focusing quite a bit more on chronic pain. So acute pain would be your acute injuries. I mean, less severe would be just a scrape or a bump. More severe would be a fracture. And then also other, respiratory tract problems which might result in pain as a result. Dental pain. I mean, you could go on, but these are the most common things. The more chronic things are the things that I tend to focus on.
A bit more serious. And we're imagining that we are now, of course, in a world where if your child is experiencing chronic pain, you've consulted a medical practitioner. Otherwise, medical services are still available for that kind of consultation. There'd be a prescription that would have been given to you to, and obviously very important right now to be stocking up or making sure at least that your prescription is up to date. That if you know you only have a few days left, call your pediatrician or your doctor in order to...
Exactly. So what is important right now, so doctors are, especially for serious cases and patients who actually do need follow-up, that is a problem. We're trying to limit contact, but telephonic consults are something that I'm doing and something that a lot of the general practitioners are doing. So if you're in doubt or if you're worried as a parent or caregiver, then there are people out there who will be able to assist you. So you're not on your own. There are telephonic consults, and if need be, and you have to go in to see a doctor, pediatrician, casualty, whatever the case may be, there are people out there to assist you. So you aren't alone in this time as a South African.
Especially in this time of isolation. So if you were to advise us on, let's say, the starter kit, if you will, of pain medication or pain treatments that one might need for those more acute, irregular kind of pains that you're likely to see, a little stomach ache, a little headache that might come from a upper respiratory condition. What would you say? What is the ultimate kit to have?
To have at home. Well, I think just mainly to deal with little cuts and bruises, so a general first aid kit. But at the same time, I'm not advocating for people to go out and rush and buy all these things. But it would be useful just to have something like paracetamol at home. I mean, that's just safe in general and is readily available. Well, perhaps not now, but and then bandages, some plasters, some strapping if need be. So just the very basic things. If you need anything more, then you probably need to seek some medical advice.
And as the mom of a 6-year-old, with your vast number of years of experience in parenting, what are some tips that you have that parents can use in order to try and avoid as much as possible injuries and pain at home?
At home, yeah. So that's difficult. I mean, there are lots of devices out there that you can buy, but essentially, when children are verbal, so pre-verbal, it's slightly more difficult for them to understand. But educating your children just about the risks and the dangers in and around the home. At the moment, we are now more homebound. Some of us don't have gardens or playgrounds, but just to try and get them, I mean, watching, you know, educational programs on TV. There have been certain agencies that have actually made audiobooks and actual books free, so educational tools, and a lot of the schools have also come to the fore to provide educational tools. So they don't necessarily have to be running around up and down, but you'd want to limit that anyway. So
absolutely. Well, thank you very much for your time, Dr. Venter. We do appreciate it very much in these trying times to have the option of having a chat to an expert who can give us advice on what to do. And in fact, I think all around the world, we've unleashed probably the greatest army of all in our healthcare practitioners and professionals to come to our aid and rescue in these times. And today, we also want you to keep in mind these brave individuals like Dr. Venter and the rest of the medical and of course, healthcare professional fraternity out there that are, you know, risking their lives and putting themselves in the front lines of the battle to take care of us. And we want to acknowledge them and express our gratitude towards them. And especially Adcock Ingram OTC have created a platform where you can do exactly that with sponsors of Brave. And there you can nominate your pharmacist or your healthcare professional. You can go to news24.com or to partners.24.com/sponsor of Brave.